Welcome to Ask Dr. Vaughn. This is our very first time doing a YouTube Ask Dr. Vaughn in our new studio. So tell us what you think in the comments and make sure you subscribe and have your friends if they like talking about medical topics. We'll go ahead and get started right away. Somebody's been asking about paranasal sinuses already on the Periscope. So we'll go ahead and start diving into paranasal sinuses. My friend Francis over here does not have any demonstration of paranasal sinuses. If Francis did have a demonstration of paranasal sinuses, it would be in this area here. They used to treat acute sinusitis with antibiotics a lot. Like that was a normal thing, that people just have sinus infections, they give them antibiotics. And nowadays we're learning that, wow, what do you know? People get better even if you don't give them antibiotics from sinus infections. And so there's more of a trend to not using it and treating it more like just a viral upper respiratory infection, even though there can be some bacterial activity. Yeah, somebody just finished a Z-Pack and it didn't help. You're the same as if you didn't take it, except that now you have the only bacteria that are left in your system are ones that can't be killed off with azithromycin. So that's a little concerning. Says any bacteria still living in your body are resistant bacteria, and if you were to get a bacterial infection now, since that's what's in your body, it's going to be harder to treat. So I encourage people to, when they have sinus infections, not use antibiotics. And I did see Rusty's name there. Rusty, yes, thank you for your comments and questions on Twitter. The rest of you can follow me on Twitter too at Dr. Vaughn. So the sinus infections, acute sinusitis, where you have some fluid in your sinuses, it hurts, there's pressure, may even get, oh hi, now you're coming in that door, may even get some pressure, fever, colored nasal discharge. You can actually change the color of the discharge with the antibiotics because you're getting rid of some of the bacteria. And some people will get better more quickly with it than if they didn't get it. But people who have chronic sinus problems and keep getting antibiotics for it, they keep getting the problems and they keep taking longer to clear up, and they keep taking a longer course of antibiotics, and sometimes they don't clear. Unfortunately, these people with really bad sinus problems oftentimes have to have surgery, ENT surgery on the sinuses. And I'm familiar with a couple of different approaches to that. There's the sinus osteotomy, where the little opening into the sinus, between the sinus and the nasal cavity, is kind of opened up by surgically enlarging this area that's bone covered with membrane. So instead of having a tiny hole, you have a big hole, or ostia. So that'll take longer for it to come back. Maybe there's more of a chance that it won't grow back. Sinus surgery is not a friendly thing to the body. It's not fun to go through. So if you're going to consider doing it, you must really have problems with headaches and pressure and feeling sick from the drainage to go through with that. Many people who end up doing that and see the ENT doctor have gone through several courses of antibiotics on the way to that point to discover that, hey, the antibiotics just really aren't doing it. There is something else that's done for chronic sinusitis, and that's a course of steroids, or like prednisone, for a number of days. And that oftentimes will get the swelling down. Now, some of you that know about prednisone and what it does to the immune system will say, hey, that's a little scary to use something that actually compromises the immune system, which is what steroids do, when the thing you're fighting off is an infection. And you're right, that is, it does make you a little vulnerable to bacterial infections and can make you get sicker or get into trouble with infection to be used, even if you aren't fighting an infection with it, using steroids for another purpose. It makes you vulnerable to infections. So there's a degree of risk there, but sure is nice to get that swelling down. Does bacterial and viral have different colored nasal discharge? Generally, we associate the colored discharge with the bacterial. You can clear it up with antibiotics, but that doesn't necessarily get rid of the problem. Immediate relief, you can use decongestants if your doctor says it's okay for you to use them. The problem is many decongestants can be dangerous for people, for example, with high blood pressure or sensitivity to stimulation of the autonomic nervous system or the fight or flight side of the nervous system, because they can make you shaky, make you stay up at night. The ingredient is pseudoephedrine in California. Maybe it's the same all over the country, I'm not sure. You have to have have the pharmacist bring it from behind the counter, and you sign your name and show your ID, because it's limited how much you can get. People can make methamphetamine out of it, interestingly, which probably helps nicely for congestion too. I guess that would be a decongestant. Yeah, the meth heads, that's right. Okay, thank you so much for answering my question. I'm so sorry. And do know, and let me say this to you. In wanting relief, and there's nothing wrong with wanting relief, don't mistake throwing antibiotics at the problem for something that's going to make it better. There's a chance it will make the symptoms last for a shorter period of time, but it's very minimal and not really worth it because of such little difference between using them and not using them. Even though there may be a difference, it's not enough of a difference that it's worth having people develop resistant bacteria every time they get a sinus infection. We differentiate sinus infection from just a cold in a couple of ways. One is you don't start with sinusitis. Sinusitis or a bacterial sinus infection is always secondary to some other upper respiratory infection, usually from a cold or a virus that's similar to a cold. And it'll kick in about 4 or 5 days into the illness. So you have a cold, you got the runny nose, and then 4 or 5 days into it, oh man, you got this pressure in the cheeks, and you've got, or above the eyes, you may even feel it in your teeth, then you have a fever, you feel bad and headachy. That's the acute sinusitis, and that's the setting where we would consider use of antibiotics. It's usually tender to push in on the sinuses, either right above the eyes or right on the cheeks. We have an interesting tool. Would you guys like for me to demonstrate here on Periscope right now how we use a transilluminator on the sinus to make an orange glow in the sinus cavity in a dark room? I could go to our exam room. Okay, why don't we do that? We'll take a walk through the office here. Hey, this would be a good chance for you to share with your friends who are interested in medical topics so they can see what this looks like. Now, I can only do it if room 2 is not occupied. Let me walk through the lab to exam room 2. Yes, we can have the room to ourselves. Okay, so this is exam room 2. It's our IENT room, and in it we have a special little attachment here called the Transilluminator, and it's just a light. That's all it is. It's just a light. And it goes on the head of one of our scopes here. And give me a moment to set it up. So I'll take that off, put this on, and I'll have to clean this after we're done. Okay, now I'm going to put this on the corner here, and then I'll come over to you in a moment once I get the light turned off to the room. But you know what? I can't just put that there because I'm on a short leash. So I'm going to turn off the light. Oh, this is kind of cool. Where's the stool? I'll just sit here. All right, so I take this bright light. Oh, there's another light in the room. Now, the transilluminator is the only, well, transilluminator and my cell phone are the only lights in the room. Put it right up to the cheek. And we'll look here. I don't know if this will work on Periscope. But what I'm doing is trying to get a nice big glow of the sinus cavity. And it looks just kind of weird on, actually that one might be kind of working the best. Looking at the front. Anyway, what you would see in this area is a dark area in the sinus where it's filled with fluid if somebody has a sinus infection, instead of it glowing. Yeah, I can't really see that much. This one looks kind of good, the frontal sinus. So for those of you who didn't see where I put this, this is my nose. This is right in front of my eye, pointing up, kind of right in front of the eyelid, upward into the bone. And then the frontal sinus is inside. Or watching this on YouTube and you want to participate live, then you need to follow at Dr. Vaughn on Periscope, and that way you can get in and you can give hearts like many people are doing right now, and I appreciate that. And you can also get notified of when I'm live so that you can participate in the conversation. Let me know what you guys think. Put it in the comments below, and we'll go ahead and sign off here until next time.